My name is Sehu Sise. I am the director of the National AIDS Secretariat. The National AIDS Secretariat was established in 2001, and it's under the Office of the President, and it is charged with the responsibility of coordinating a multi-sectoral response to the national AIDS control program. As a secretariat, it is responsible to monitor, coordinate the national response to HIV and AIDS in the Gambia, trying to bring everybody on board in the fight against HIV and AIDS.
The National AIDS Secretariat is mainly as a result of government's resolve to look at a multi-sectoral response against HIV and AIDS, in the sense that when HIV/AIDS was first discovered in this country in 1986, government responded by creating the National AIDS Control Program. But you would agree with me that it was purely a health sector response. However, if you look at the impact of HIV and AIDS on the development of nations, it covers all sectors. And as such, one needs to look at the social fabrics and all other sectors as they are also equally affected. Therefore, the best approach is a multi-sectoral approach, which is looking at each individual, each community, each sector. It was as a result of that the Gambia government, in collaboration with the World Bank, developed a project proposal which is called the HIV/AIDS Rapid Response Project. Well, one of the requirements of the HIV/AIDS Rapid Response Project is to create a multi-sectoral HIV/AIDS response coordinating mechanism that would ensure the involvement of all sectors. This led to the creation of the National AIDS Council, which is chaired by the President of the Republic, and the creation of the National AIDS Secretariat, so that it can be the technical arm of the Council to take the lead in terms of coordinating, but also in terms of planning and guiding a concerted effort to make sure that everybody is on board in the fight against HIV and AIDS.
We work in partnership with people in the public sector, people in civil society, NGOs, community-based organizations, and also private sector. Because like I said, our work is linked to coordinating and monitoring the national response, and we need to work with people. As you know that HIV and AIDS is a cross-cutting issue, which means that all hands should be on deck, and all quarters of society, people from all walks of life should be involved in the campaign, in the fight against HIV and AIDS. And we are working with our colleagues and partners in these areas, including partners in the UN system, in trying to consolidate our response to HIV and AIDS.
The NAS is not an implementing agency per se. What the National AIDS Secretariat actually does is to look at various partners, and through those partners we provide them with support. And the support is not only limited to financial support, but also technical support, so that they can be guided. In other words, the resources come through NAS, and NAS makes sure that the resources are available to partners who otherwise would not have been able to implement HIV/AIDS-related programs because they have limited capacity, either technically or they do not have the financial resources to scale up their interventions. So the NAS does not own programs per se. However, in terms of our role, we look at the overall policy issues. We also look at the overall strategic direction. We also look at planning and guiding partners to be able to implement programs that are within the framework of our national strategic plan. But we do not go out into the field to create awareness per se, except where that awareness creation is limited to the structures that we have created. For instance, the National AIDS Council, the divisional AIDS committees who would target specific groups in the various communities that they are serving. Either they're going to be a women's group or youth group or religious group. But basically, that's what we do. But in terms of actual implementation, we do not go out there. So when we hear people say that this is a NAS program, we're quick to correct them and say no, NAS has no program. You have your programs and NAS is only guiding you technically and where you need the financial support because you do not have the resources that you need to do what you are better than doing. Then we guide you in that process.
I am Mr. Aliou Jame. I work for the Department of State for Health under the National AIDS Control Program, and I'm currently the manager for National AIDS Control Program. We are responsible to implement activities relating to HIV, STI, and AIDS under the Department of State for Health. When the first case of HIV was discovered in 1986, there was the need for at least a response. And then by then the health sector, which is DOSH, felt it was a health problem and should have at least a health-led response. Therefore, they formed the National AIDS Control Program as a response to the first case that was described in the Gambia in 1987. We're involved in the fight against HIV and AIDS in many ways because as a health sector, we are operating at all levels, at the community level, at the basic health facility level, and at the tertiary level. Because of that, we have activities that are community-based activities that is relating to awareness raising. We also have activities relating to treatment, care, and support. And again, we have activities for advocacy, behavioral change, and the like.
Before I tell you my name, I think I would want to thank Vinasa for taking this bold initiative to document some of the successes that have been registered in the fight against HIV/AIDS in the country. My name is Keba Jom. I'm the Municipal AIDS Coordinator responsible for Kanifing Municipality. As you may be aware, the National AIDS Secretariat is decentralized in such that in each of the divisions and municipalities there is a coordinator responsible to spearhead the coordination. So that's why I'm here in KMC, spearheading the fight against HIV/AIDS in the municipality. The Municipal AIDS Committee is the equivalent of the Divisional AIDS Committee in the divisions. So it's composed of a diverse membership ranging from government officials representing their various departments in the municipality, NGOs, civil society, faith-based organizations, people living with HIV/AIDS, and it is chaired by the Lord Mayor of KMC, and I'm the secretary to that committee. So this committee was established way back in 2002 when they were reorientated. Then when I came on board in 2003, that's the time it started functioning. So from that time to now, a lot of things have been happening here under the leadership of, or under the guidance of the Municipal AIDS Committee. So that committee is subdivided into 3 subcommittees. We have the IEC subcommittee responsible for dissemination of information, and we have the proposal review subcommittee that looks at proposals from partners or from CBOs and from women groups and so forth. And the 3rd subcommittee is the monitoring and evaluation, because you cannot dish out money and you don't go into the field to see whether what is dished out is implemented accordingly. So these are the 3 subcommittees that the committee is composed of. So it has a membership of about 25 people. So as I said earlier, it has a very diverse composition. So we've been doing a lot of things ranging from sensitization, capacity building of CBOs, and disbursement of funds. And as I speak to you, we've disbursed over $14 million within KMC to CBOs and NGOs and women groups as well. So the MAC has been doing a lot, and we've achieved a lot. We've been preparing reports, and at the end of every year, we organize an annual MAC review where we invite partners to sit with us to review what has happened in the previous year, the successes, the constraints, and the way forward.
UNDP started supporting the HIV/AIDS intervention in this country since the inception of the AIDS control program. That was way back in the mid-80s. And then this program was housed at the Department of State for Health, then Minister of Health, in the National AIDS Control Program. So basically, like UNDP was responsible for supporting virtually all or most of the HIV/AIDS intervention, being spearheaded then by the Ministry of Health and Social Welfare. It was felt that there is need for a full-time coordinator to be appointed, and then that was why, since I was the one who was coordinating the project at the Ministry of Health, I was seconded, and I'm now with UNDP, wholly and solely looking at the UNDP HIV/AIDS project. But I work closely with colleagues at the Department of State for Health, especially at the National AIDS Control Program. So what we do in this project, we support the Department of State for Health interventions in HIV/AIDS prevention. But then we also work with like the Santayala Support Society, which is an association of people who are living with HIV/AIDS. We also work with BAFRO, which is an NGO that is working with women dealing with reproductive health issues and also HIV/AIDS prevention. We also support the medical school of the University of the Gambia. So in a nutshell, that is what this project is all about.
Tango was formed by because of certain NGOs has a concern of avoiding many NGOs to has duplication of efforts. At the same time, they can avoid competition and maximize the small resources that they mobilize. And that was why some few NGOs who make it as a concern that they should come together and form an association. That's how Tango came into being. Tango has been, because some of our NGOs, we have a large number of NGOs, presently about 68 members of Tango. Some are international, some are local NGOs, some are community-based organizations. And they work in different areas. Some are particularly concerned with health, and under health, they deal with HIV and AIDS. But in this past 5 years, Tango was involved in HIV/AIDS sensitization and capacity building when Tango was approached by the National AIDS Secretariat to be part of their technical review committee. And Tango was nominated me personally to be in that technical review committee, and we have been given as the chair. So during those reviews, we found out that most of the NGOs and CBOs have a low capacity, lack of capacity in project proposal development. And if the chunk of the money in NAS is for the civil society organization, that's the CBOs and the NGOs. But we found out that some of the CBOs could not write good proposal, and some of our national NGOs. So Tango approached NAS to capacitize Tango so that we can in turn train some members of our organization to be able to write good proposals so that to be funded by NAS to fight against HIV. That's how Tango came to be very, very much involved in this. And luckily for us, NAS accepted this. We wrote a proposal to NAS. It was funded, and we trained 40 of our NGOs in project proposal write-up, but focusing on HIV and AIDS. So some of our members, we trained them here on 4 in batches. Fortunately for us, all 40 NGOs were trained, and I can tell you 3/4 of them have acquired funding from NAS, and they've in different areas of the country, and they have been fighting against HIV and AIDS through sensitization, VTC, you name it, home-based care, all whatnot, because we have different NGOs doing different capacity beyond HIV and AIDS. The amount of money that was disbursed to these NGOs amounted to something like over $30 million, and we are proud to say that our partnership with NAS it was very good, and our members have been doing very well in the area of HIV and AIDS.
You know, HIV, in the initial stage, it was seen as by Gambians as a health issue. This is why not many people know about the disease. But with the advent of this present project with NAS, it was thought very much necessary to take the fight to the grassroots level by involving all sectors of life. And this is why work as a community-based organization, we also take part. I could say we were the first organization in Western Division that accessed funding in 2003, May. we had a category B contract with NAS, but that category B contract was only geared towards sensitizing people. We hold a training of trainers workshop, which was the first of its kind in Western Division, and we invite sister organizations and our own members. We train them. Then this is to train them to know about the existence of HIV/AIDS, and also to at least acquaint themselves to live together with people who are already affected. Nova Scotia Gambia Association came to the Gambia as a result of the interest of my executive director, Boris Devine. He came and then worked in the GTTI. In 1992 to 1994, they started a education program in 10 high schools. We call it teen high schools. And then there are about a couple of teachers, a dozen of teachers were involved, who we are called counselors then. And they started the education program in different high schools, mainly in the combustion area here, and a few schools in rural area like Armitage. And the objective was to use students as a vehicle to bring relevant health information to their own peers on the general health issues that affects the lives of young people.
I am Baturu Kamara. I'm working in Nova Scotia Gambia Association. During my time at NSG with the Peer Health Education Program as a regional coordinator, when we go to schools, we look at the equal numbers of boys and girls. You know, how many girls are supposed to be peer health educators and how many boys are supposed to be peer health educators. Most of the time, you know, we concentrate on the equal numbers of boys and girls. Why? Because if you look at in the Gambia and many African countries, girls and women are most of the time left behind. And you cannot talk about HIV/AIDS or any other health issue without looking at that gap between women and men, or between boys and girls. Because when it comes to information sharing, most of the time it is the men that have access to such informations and so forth. And you find out that, you know, that goes on, you know, it's a trend that goes on up to when they get to adulthood. The women are most of the time concentrating on household work, how to take care of the children, you know, going into the fields and so forth. They don't have that time to listen to radio, to be able to go to the hospital in decision-making powers and all other things, you know, that are making them, women, not to have access to information or even go for treatment. So NSGA, we have that values and said, you know, we have to make sure that the peer health education program try to bridge that gap between boys and girls. So that's why we always focus on that. In any peer health education program, all the teams, we make sure that we have equal numbers of boys and girls, so that the girls, because the unique thing about the peer health education program is that it is, you know, looking at HIV/AIDS and health issues together with the young people. Because we know that the young people, they learn from each other and they learn from adults, they learn from the system and the environment that they find themselves. So it is the peer health education program try to help, you know, make that environment, those situations conducive for them, so that they'll be able to learn good things about health and how would they protect themselves.
Our focus this time from 2001 has been HIV and AIDS, but we don't only deal with HIV and AIDS. You will know, and you will agree with me probably, that there are other issues also that also surrounds HIV and AIDS. Young people need to understand their body and the way it works. They also need to know that there are other diseases that we can also get from sex, for example, sexually transmissible infections. So we train them on sexually transmissible infections. We also train them on tuberculosis. We can actually affect your immune system, and it can also make you sick. And there is a lot of tuberculosis in the country, and there is a need for young people to practice healthy lifestyles to protect themselves.
Advocacy has been in this country for a very, very long time. So my involvement there is like, I'm very, very particular how women can definitely have access to informations that are related to HIV/AIDS and its related issues. Because if you come to decision-making power, like I said before, it is difficult for the women to make such choices in the African context. Women, most of the time, they cannot decide when who and how to have sex. Most of the time, these things are decided by their counterpart, either their partners, men, or by members of the family. When it comes to early marriage or whom to marry, the girls, most of the time they don't have those decisions. They cannot make those decisions. We have the issue of forced marriage here. We have the issues of early marriage and so forth. We also have the issues of inheritance, wife inheritance, or whatever you call it. Women, most of the time, they cannot decide. They are not, given that chance to decide who they should marry, whom they want to have sex. You have the issues of rape and all other things that are making it difficult for the women of the Gambia and many parts of the world to be able to fight, when it comes to HIV/AIDS, or to protect themselves against HIV/AIDS. So my focus, basically, when it comes to HIV/AIDS, is how can we empower the women of the Gambia to be able to protect themselves against HIV/AIDS.